What if, for one day, the country had no child care? It's a reality several Nevada families are facing every day, and experts are warning about the wide-ranging consequences this week on Nevada Week.
Support for Nevada Week is provided by Senator William H. Herrnstadt and other supporters.
Welcome to Nevada Week. I'm Amber Renee Dixon. Monday, May 11th marks the 5th annual National Day Without Childcare. Last year, organizers say more than 1,000 providers in 43 states closed their doors to protest low wages and demand more access to affordable, quality care. But for many families, the struggle isn't just one day. According to the First 5 Years Fund, a national early childhood advocacy organization, 28% of working families with young children in the U.S. cannot reasonably access the care they want or need. Here in Nevada, that number jumps to 66%, the highest in the country. And at a recent interim legislative hearing, one parent explained what that looks like.
As a parent of a young child and one with special needs, I've experienced how disconnected and confusing our early childhood programs can be. Every service has its own process, its own application, and its own timeline. So when we're trying to support young children, especially during their most important developmental years, navigating all of that alone becomes overwhelming. Families like mine often spend more time trying to find help rather than actually receiving it.
And that challenge has a price tag. The First 5 Years Fund estimates Nevada loses about $1.5 billion each year in earnings and productivity because families can't find or afford quality child care. So why is Nevada coming up short, and what would it take to fix it? Joining us now, Elisa Caffaretta, Executive Director of the Children's Advocacy Alliance, Jordan Samaggio, CEO of the YMCA of Southern Nevada, Nevada Assemblywoman Erica Mosca, representing District 14, and Deetra Stewart, President of the Family Child Care Association of Nevada and operator of a licensed home-based child care program in North Las Vegas. Thank you all for joining us. Let's start out with that question. Why is Nevada coming up short in the child care space? Deetra, you told me you've been in child care in Nevada for more than 10 years. What do you think?
Well, one of the things that is continually to change is the cost of child care. It is basically a federally funded view that is going on, and Nevada just is not keeping up with the cost of child care. We have wages that are going up, we have the licensing is going up. It just costs much more today to fund the child care industry.
And are wages going up for early child care educators? Because that's a complaint of not having enough workforce, is that they're not getting paid very much. Who can give me kind of an idea of what these people are making?
I think that it's true that they are some of the lowest paid workers in the state. They make on average what somebody at a fast food restaurant or in a retail setting makes. And because of the cost of the business of doing childcare is really what puts that pressure on those folks. But what's important for families to understand is those frontline early childhood workers are the ones who are delivering the quality experiences. We know, young brains, those first 3 years are foundational for a lifetime of growing and thriving. And what makes that possible is those repeated positive experiences with parents and family, but also those early childhood educators. So we need to find a way, and lots of other states have found ways to dedicate funds and create programs around paying these workers more.
How much do other states rely on federal funding compared to Nevada?
I think Nevada is in the unfortunate club of states that does not supplement that federal child care subsidy grant with state dollars. Over the years, we have done one-time shots like we did $10 million about 5 years ago. We had a lot more money during COVID, but since those COVID dollars have stopped coming into the state, we've really pulled back on the support we provide to families in Nevada.
Assemblywoman, funding, that's your alley.
Yes, and first I'd say, Deirdre is really the heroes, right, when it comes to childcare, when it comes to who's actually doing the work. So thank you. And I know we're going to hear about your program later too as well. And so we know that young minds are the most important, as you said, and we just have to make a decision in Nevada that we care about our workers, we care about our young learners, and that we want to invest. We have to make a decision. I know not everybody likes taxes, but that's the reality of some sort of revenue that would then pay for this. And it's also the will. You talked about the ROI, how people are not able to work, right, if they don't have childcare. And so we have to make sure we change the will of the people out there to understand, even if you don't have kids, even if your kids are grown, it impacts you, it impacts our community, and it impacts our state.
Am I hearing you correctly that the only way to fund early childhood education in Nevada is by raising taxes?
We need more revenue in the state for a lot of things. I think this is a very important discussion, but we also pay for people who have Medicaid. We pay for the education budget. We pay for the 100-year-old school in White Pine. And so the state funds pay for every social service basically in Nevada other than our county and our local funds. And so I don't think the only answer is more revenue, but it has to be part of the conversation.
Jordan, what are your ideas on revenue generation?
I think there are baby steps that we can take today. And what I mean by baby steps is there are pots of hundreds of millions of dollars left on the table that the state has leveraged in the past to fund projects that it prioritizes. In the last, a couple legislative sessions ago, I think it was 2023, the state was able to find about $100 million towards homelessness. So there is certainly a revenue shortage given our population, the lack of our diverse economy, but there are pots of funding that we can start to leverage today. Is $100 million the end-all be-all? No, but gosh, that could really put a dent in this crisis.
That project you're talking about is Campus for Hope, and then that also had funding from the private sector.
That's right.
A lot of the hotels and casinos. Has there been any talk of them getting involved in funding? Well, I guess that's actually probably been talked about for a long time, getting them involved in funding K through 12 education, which is projected to have about $160 million shortfall compared to what was predicted, I think, last year. Okay, that's a hard one, right? What would it take to change the model and have state funding even go to early childhood education for 3, 4, and pre-K?
I would say, in my opinion, so I was an educator before this. I was in the classroom in East Las Vegas. I did start and run a nonprofit for a long time. So my view is not only from the political landscape, but also on the ground. I have never heard so much talk about pre-K, childcare, about a mixed model. I think even getting people to understand pre-K is different from home-based childcare, is different from center childcare, that we need all of it. I don't think I've ever heard so much conversation. So like anything, it's education, it's then organizing and getting people excited and involved, and then showing them how it impacts them. I think the more we can show, that's why Monday is so important. All of our employers are gonna miss out if folks don't have childcare, and that impacts our state budget and it impacts all around. So I think we have to continue to have these conversations, make sure everyone's at the table, and I think next session really do something about it.
And I'm sorry, I was going to add a little bit to that. So now there are pilot programs that home-based providers now have Nevada Pre-K. They have Head Start in their home. And we do want to offer parents the opportunity to have choice.
Yes.
Everyone does not want to have their 2-month-old in a school environment, right? And so that's where home-based providers come in. And so it's essential that we are part of the conversation.
Are there any myths surrounding home-based childcare that you want to address here?
Well, one of the most common myths we're babysitters. right? Or that maybe we're not evaluated and we're not assessed often enough. But we have what the program QRIS, which is the Quality Rating Improvement System, right? And so people are coming into our homes all the time assessing us, right? Whether it be fire, health, QRIS, the Department of Ed, we are constantly being observed to make sure that our programs are high quality. And the high quality really stems from even what the governor has said, that he really wants to make sure that we all are doing, right? Whether it be home-based, whether it be Head Start, whether it be in the CCSD. So we just wanted to make sure that you all know that high quality is going on. We're not babysitters anymore, right?
And that's for organizations like yours that have applied to be part of the QRIS program.
Absolutely.
But there are others that are not part of that.
Absolutely. And we, again, we have the Family Child Care Association of Nevada, and we are stepping in places where you may not know about. And we are actually going to those providers, right, and letting them know that we are available there to help them. You can become licensed. It has been very difficult in the past to become licensed, but as we represent providers, that conversation is now coming out that we want to make it easier for people to become licensed. Because if you have individuals taking care of children that aren't licensed, it can be all bad.
Okay, another approach to addressing this issue comes from the YMCA of Southern Nevada. Its pop-up preschool model first opened in October of 2024. It's called Skyview Early Learning Village, and it's located on Centennial Parkway near Pecos Road in North Las Vegas. Its modular design helps lower construction costs and expand access more quickly, and the Y says it hopes to replicate this model across the region.
We are trying to get all of our kids ready for kindergarten, and I just love doing it, and so do my teachers.
Maisha Williams is the director of Skyview Early Learning Village. Children can attend the YMCA pop-up preschool at a reduced rate or for free, depending on income.
We have free preschool, which is Nevada Ready, where if you qualify by income, your schooling is free for your child. That's amazing. That would have worked and helped me so much.
Williams says when her son attended preschool, she worked there and got a 20% discount on his tuition. Had the YMCA model been available to her son, she'd have received a 50% discount.
That's amazing because childcare is very expensive around here, and as a single parent, I learned the hard way that most of my check was going to paying for childcare.
Above all, quality childcare is what Williams says she wanted for her son, and now it's what she aims to provide her students. One indication of her success is the preschool's participation in the state's Quality Rating and Improvement System, known as QRIS.
You have to follow certain rules that if you are not QRIS, you don't have to follow those rules. So you have to have centers, you have to have classrooms that are full of supplies for the children. You have to have where your teachers are going to school and getting the extra education that they need. So that's important. For me as a mom, I never wanted to just let my son go anywhere. So I love the YMCA.
All right, Jordan, this pop-up model is your baby.
It is.
When are you going to open the next one?
We're opening up our second one at the end of this year on Torrey Pines in Cheyenne, called the Torrey Pines Early Learning Village. So far, all of this has really been sponsored by Clark County. The county was seeing a huge need in the community and how that was impacting a myriad of county services. So county being the ward for welfare and foster care and homelessness, and they saw the interplay of all these different issues and childcare, and so they stepped up and found a small pot of dollars, small compared to what it really cost to build buildings, but it was enough to motivate the Y to innovate. And that's really the second piece to this conversation. there can't be an unreasonable expectation that the state comes in with hundreds of millions of dollars and overnight fixes it. There is a little bit of pressure on the sector to also innovate with the resources that we have. And so when we stepped up in this space as the largest nonprofit childcare provider in the United States, we really started to, we hired an architect and we started to look at the true cost to be able to expand and meet the critical childcare shortage in this community. And the lowest cost, even with some donated land, it came out to about $10 to $12 million for every brick and mortar childcare center to serve about 225 to 250 kids. And so that's a big ask, and that's not the amount of money that the county had available. And so together with the county, we innovated and created this pop-up preschool model where we can take modulars and beautiful playgrounds and shade structures and interactive manipulables and community gardens and turf spaces, and we can put them in the most high-need communities for about $4 million, serving about 100 kids per pop-up.
You told me in a conversation prior to this that capital is your biggest issue?
Absolutely. We had to innovate in a lot of different ways. One of the first issues that we had was workforce, and so we innovated in that space. And now at the Y, workforce isn't our biggest barrier. It's certainly not easy, but it is not our number one barrier to providing or expanding care. We then had to innovate around curriculum and licensing and quality and credentials and safety. Insurance costs were going up, and so we really invested in child safety. So we really innovated in a lot of these spaces, but the one area that we just can't do as a nonprofit is capital. The cost to add seats is astronomical. Even $4 million as a nonprofit, we simply don't have it. We don't have those margins. And the reason that we don't is, as a nonprofit provider, we provide care to anyone, regardless of your financial capacity, which means that all of our rates are so affordable that there's not margin to be able to cover the expansion of the program.
So yeah, a private preschool can be the cost of a college tuition. But the YMCA, how much? It's half off for some, free for others?
It's about 55% of our families get access completely free through the Nevada Ready program, which is funded by the state. And then the remaining 45% have a sliding scale, so they could pay as little as nothing or as high as 20% below the market rate for preschool in our community.
The demand for that has to be through the roof. The Nevada pre-K system that we're talking about, it does come with a little bit of difficulties recently, right, Elisa, as far as reimbursement? What is your take on that program?
So I don't know if the reimbursement challenges are in the pre-K or in the child care subsidy program, which is separate from the pre-K piece.
Okay.
So there is the federal government money that we talk about that supports childcare is a subsidy program for parents to go out and enroll their children in childcare. That is it's mostly federal money. It's administered through the state, and that program actually had been done in partnership with some nonprofits, and then the state pulled it back after COVID. So in that transition, there have been some real challenges in getting those reimbursement payments out to the child care providers. It is improving, but it's always sort of challenging to get a state program to innovate. So, and that's a huge problem to the child care businesses because at the end of the day, they are businesses. They have to pay their employees and buy their supplies. So if they're waiting 6 weeks or in some cases months to get paid back, that's a challenge. But the state has sort of focused on improving that, and we're still in conversations about.
That's right. We're still in conversation about that because there's a lot of challenges that happen. We just recently had a conversation with one of the partners, and it is communication. Right? It is communication, but at the end of the day, a child care provider still has to pay their mortgage. They still have to pay their staff, and parents are really relying on us.
Can you give some background to that too? Because this involves funding from, I believe, urban league that was then taken over by the state. What's the background on that, Assemblywoman?
Yeah, and I think I would agree communication, I think, is the most important part so people are on the same page. There are a couple things I would mention here. This is actually an example that I always give of what it's like to be a legislator. The first time anyone has ever looked up my address and come to my home and knocked on my door to complain about something, which was actually a little scary, was a child care center that was not being paid on time, had not been paid for a really long time, and it was through the nonprofit provider. So I immediately escalated that up of what's this issue here, and then I found that there was one in my district that also hadn't been paid. And so to the state's credit, what they did was they looked into it and they did find fraud. And that is actually why we cut the ties with the nonprofit provider. So you have that happening, and then you have this issue that from the federal government, there's way less money coming into the state that we all know about. And the state decided we're going to now administer it because this happened by having this pass through. And what had happened, and what I would say is our fault as a legislature or as a state, is we did not give them more funds to then say we're going to implement a program through the state, which again comes to this revenue conversation, right? What funds is that going to come from when we have less funds? And so I think they are trying their best. They know communication. They know they need to get back to people. I would say too, as a foster parent, I know from the other side what it's like to sign the time cards, to make sure the timesheets are in and that my center is getting paid. And so I see both sides. But the biggest thing I know is there's a lot of people care about this issue and that they're going to continue to improve on it.
I want to move to the topic of HOAs and home-based childcare programs. You were part of some legislation last session that would have prevented HOAs from preventing people having home-based childcare programs, whether they own the house or are a tenant. That got to the governor, and he vetoed it. He said it undermines the foundational principles of homeowners associations. HOAs exist to preserve a consistent and predictable living environment by allowing residents to agree in advance to a shared set of rules and community standards. How do you combat that next session?
Well, one of the first things that I would say, because I live in an HOA, right? And actually, my HOA, it's a good HOA, right? And it does exactly those things that you said. But we at least need this to come to the table so that we can make some adjustments. Because once again, if we don't have child cares in our homes, then now we're not allowing parents to have choice, right? And so the HOAs, they are definitely there. We understand regulations, but we have to make some changes in those regulations.
And I think the thing about the HOAs is that in Las Vegas, pretty much all new construction is included in an HOA. So you're really precluding this choice that parents have. And most parents, especially for their youngest children, want to have them in a home setting. So Absolutely. We just need to have this option. And they still can have regulations and rules around it, but there would be zero home-based care. And home-based care is really 3-4 kids. I mean, we're not talking about 20, trucks pulling up to your house and you're running a business out of it. So I think there's room to have that conversation in the next session.
Any ideas on how to get the governor's approval?
Because for me, it's this will and values question, right? What are we valuing? The HOA's opportunity to do what they want to do, or is it childcare? And so the legislature passed the bill. We, as a majority, said we know this is important, we believe in it, and it got vetoed. And so we need to do whatever we can to show that it's about choice, it's about families being able to work, and that it's going to help all Nevadans.
Last question for Jordan. What is at stake? What are the consequences if Nevadans, young children, continue to not have access to quality and affordable childcare?
Gosh, let me wrap it up with this. A governor's report a couple of years ago found that 7 in 10 families in our state can't access licensed childcare, and that nearly half of employers are saying that this is the #1 reason they cannot recruit and retain staff. It's forcing tens of thousands of parents to leave the workforce entirely, which is costing our economy over $1 billion each year. So when we're talking about building facilities and taking $100 million, imagine that investment, that we can 10 times that investment in just a single year. When kids don't have access to childcare during these early years, 0 to 5, during those early years is when 90% of a child's brain is developed. So we're setting our kids up to fail. We're sending them into kindergarten already years behind. And so we shouldn't be surprised that our education system consistently ranks in the bottom 5 in the country. Children who attend high quality programs are 5 times more likely to own a home. They earn 14% higher earnings. They're half as likely to engage in crime or need welfare or affordable housing. This is the solution to many of the issues that we talk about every single day, and we just need to start earlier.
That was excellent. Thank you so much. You could not have said it better. And the parents are going to keep their children at home if they don't trust.
That's absolutely right.
If they don't trust our decision, our choices, and they get to trust. They get to trust us. It's a privilege, right?
Absolutely.
And you get to choose. You get to choose if you want your child to be in a home base, if you want your child to be in a center, if you want your child to be with a nanny.
Sure.
It's your choice.
Or if you choose to not work because you choose to stay at home with your child.
Yeah.
Let's get this group back together at some
Absolutely.
point.
I love
Thank
that.
you all for joining us. And
Thanks,
thank you
Amber.
for watching. For any of the resources discussed, including information on the local events taking place on National Day Without Childcare, go to vegaspbs.org/Nevada Week, and I'll see you next week on Nevada Week.